during COVID-19.
Live Unrehearsed on CJAD 800. Brought to you by Marco Vendramini of IG Private Wealth Management. MarcoVendramini.com.
And welcome back to Life Unrehearsed. I'm Matt Del Vecchio, specializing in life transitions, downsizing, and the senior living industry.
And I'm Corey Sirota, clinical social worker and psychotherapist, specializing in grief and loss. So, Matt, we have an amazing guest coming up. I have to ask you before Georgia comes on, do you have any phobias?
You know, not too many, but, my previous corporate life was very much involved in the cleaning and sanitation business, so I'm a bit of a clean freak, and I have to say, I'm feeling a little bit more germophobic these days. I think many are, but I would say that certainly that one's out there. What about you?
The one that sticks in my mind the most clearly is snakes. I have a phobia. I don't even know why. Probably because growing up, my mom had a fear of snakes. It's not like anything ever happened, but there I was in South Africa last year, and I was like, I'm like, do me a favor, guide person. I do not feel compelled to see any snakes. If I don't see one the entire trip, I'll be good. That'll be good. And thankfully, we did not.
You were fine with petting the cheetahs and jaguars and seeing the lions, but snakes, no. Okay, I get it. You know, there are some crazy phobias out there, Corey. I'm going to throw a couple your way. See if you know any of them, okay? Electorophobia.
Fear of voting.
Oh, very good. But it's actually an intense fear of chickens, believe it or not. And here's another one.
I like mine better.
Arachibutyrophobia. I'll repeat that. Arachibutyrophobia.
Well, arachnophobia is fear of spiders, so I think, or snakes.
It's
fear
the arachie, which is French for arachide.
Fear of peanut spiders. Peanut-covered spiders.
Well, you're getting there. It's the fear of peanut butter sticking to your mouth. Believe it or not. And one last one here. You know what? Many probably have this one without even knowing it. It's called syngenesiphobia.
I don't know. That has to do with George Plum's detective sinning.
No. Syngenesiphobia, it's the fear of relatives.
Oh,
many people might even have this.
This may be actually something you with that, and it's a darn good thing that we have Georgia Dow on the line to help us out here. So, there's like at least 107 phobias, ranging from the traditional fear of heights, fear of spiders, and some of the rare fears that Matt and I just pointed out. Unbelievable. So. Maybe one of you listening has one or a couple of phobias, and perhaps I would say that this pandemic may have really brought some additional phobias or exacerbated some of the phobias you have. That's why I am thrilled to have licensed psychotherapist Georgia Dow on the line here to help us learn more about these phobias, but also to provide us with some helpful hints to effectively deal with fears and phobias. Welcome to Life Unrehearsed, Georgia.
Thank you so much, Corey. Thank you, Matt. My favorite, actually, more rare phobia would be kinemortophobia, which is, does anyone have an idea?
I'm going to say fear of dead bodies.
Close. Fear of zombies.
Oh.
Okay. Have you had to deal with someone with that?
I haven't. One of my colleagues did. I would have been excited to help someone with that one, but I did not get the opportunity to.
So, I'm sure you would. Georgia is incredible. I've had the pleasure of working with Georgia and seeing her work her magic with some clients. So let's start with the simple ones. What are some common phobias?
So some of the most common phobias that I deal with is social anxiety. So that one is the fear of judgment from others. Claustrophobia, which is enclosed spaces, and agoraphobia, which actually has increased now because of the pandemic, which is the fear of the outside, pulling out open spaces. There's also the fear of being trapped, which is often the claustrophobic feeling, but it can also happen in agoraphobia. Like there's no way to kind of get to a safe zone. Fear of heights, we deal with quite a lot. And I think that also that fear of not achieving our dreams, not doing as much as we should, which has actually gone down since the pandemic. Now people are like, you know what, I don't have to do as much. No one's going out there to do anything. So often that fear, that type A personality of achievement is actually much less now. And so I see that very rarely.
Quite interesting. Now, Georgia, I'm always intrigued about how these phobias develop. Corey just mentioned, snakes, and maybe it had something to do with your mother and the history. Sometimes there's events that happen, I guess, when you're a child. So is it genetic? How do phobias develop?
Oh, it's really fascinating. So yeah, sometimes something could happen, like you were seeing a butterfly and someone startled you, and that could give you kind of a fear of a butterfly. But some of them are also primal. A lot of them are linked to our own survival. The fear of the dark, right? We can't see in the dark, and a lot of predators can. In the dark, we could fall into a pit or hurt ourselves or be eaten. So some of them are these primal survival instincts, similar to snakes. Lots of snakes are venomous. Spiders, lots of spiders, and different types of arachnids are also, give us that primal fear of, it was smart for us to be afraid of these things because that would keep us safe. Similar to the social anxiety one, which people are like, well, that's not going to kill you. Why would people have this strong fear of wanting to be accepted and not being judged, which is pretty innate to most of us, right? Mm-hmm. So what happens is that on the hierarchy, if you were thrown out of the tribe when we used to live in these tribal villages, we have very little chance of survival. And so a lot of these are directly linked to our need to survive and helpful to us within reason.
Fair enough. That's Georgia Dow, who is talking about fears and phobias and helping us understand them. So what do some phobias look like in terms of behavior?
So there's many different ones. Often, like when you first have one, it's this avoidance behavior. So I might have a fear of public speaking, and so I'm going to try to avoid to be able to do public speaking, or not going outside, or choosing to only drive in the daylight, or not choosing to drive at all. And so the avoidance behavior is one of the first things. And so even for myself, when I think to myself, I can't do this. Not I don't want to do this, but I can't do this. That would be a warning bell when you say that to yourself, or even the opposite. I have to do this. And I would go, do I have to or do I want to? If I have to, this may be the budding of an anxiety that if I feed could increase. Because remember, whatever you do, you get better at it. And anxiety is no different. You want to get better, practice, but you don't want to practice your anxiety.
Right, Georgia. Now, we've talked about the pandemic exacerbating some phobias. What are some of the ones that you're seeing out there right now?
So I'm seeing a lot of people that are dealing with fear of illness, fear of getting sick, fear of death, germs, cleanliness behaviors, safety behaviors. So a lot of, and also of other people. So a lot of other people are not safe to me. And also for people that have social anxiety, because we've been enclosed more often and kind of living our lives in this small little secular units inside of our homes, that's increasing all of those social anxiety feelings and feelings of I might not be good enough. What am I going to do when I get out?
I'm so grateful that you are sharing this with us, because I think that people need to hear this and understand it, and let's normalize it, and we need to talk about what to do about it. So we have to go to traffic, but when we come back, we're going to talk about are phobias treatable and what types of interventions are used. So we'll hear right about that.
Live Fun Rehearsed on CJAD 800. Brought to you by Marco Vendramini of IG Private Wealth Management. MarcoVendramini.com.
Welcome back. You're listening to Life Unrehearsed. I'm Corey Sirota, along with my co-host Matt Del Vecchio, and we are talking to psychotherapist Georgia Dow about managing your fears and phobias. So I know the answer to this, but I want everyone to know the answer to this. Are phobias treatable? And if so, what types of interventions does one use?
They are so very treatable. You do not have to live with this for a long period of time. If you feel something kind of catching up on you, please go find a way to get help. It doesn't have to be through therapy, though. Let's just say it. Cognitive behavioral therapy, exposure therapies are fast, painless, quick, and dare I say even fun. They really can be, right? And if you're going to go through something that's scary, you might as well go through it with someone instead of having to go through it alone, just because of the speed. And dealing with a phobia just sucks out your life happiness to it. But if you don't want to do it that way, you could go through a workbook. You could try to go through guided meditations that are, for like guided imagery towards your phobias that are online. You could do your own exercise and breathing techniques, journaling. work on yourself to be able to deal with it. But I have to say the fastest path to Rome is to go to a specialist, get it treated, and then get back to living the life that you deserve to live.
Now, Georgia, knowing that it is treatable, and this is what you do every day, a fantastic psychotherapist. I might throw in there, Corey, two-time jiu-jitsu champion as well.
That's right.
A little side conversation there, Georgia, and good on you. But seeing that it's treatable, and that you know someone that is dealing with an obvious phobia, and for whatever reason they don't want to deal with it. It could be denial. You've mentioned.
Sorry, it's kind of cutting in and out for me.
I'm sorry. Is that better? That's much
perfect.
better. Okay. So basically, Georgia, I'll just quickly paraphrase that. Seeing that it's so treatable, and there are people that. You see your buddy or a friend, a loved one with a phobia, and they are just not dealing with it. It could be denial. You've mentioned avoidance before. So how would you suggest that you talk to someone and maybe try to push them down the right path to deal with a phobia? Because like you said, it affects them so much.
And it affects everyone that's around them as well. There's nothing like looking at a loved one suffering and knowing that they could get help and yet they don't. And I understand why not, right? That fear of being judged, having to share your innermost thoughts and feelings can be uncomfortable. And unfortunately, a lot of, the media hasn't done a great job of showing different types of anxieties as a thing that people go through. And let's say it, 33% of people are going to go through different anxieties through their life. It's exceptionally common. It's actually very normal. And it's a learned skill so that you can unlearn it. So the first thing would be to have a really calm, relaxed, easy conversation, because you can't force someone to get treatment, especially if they're, an adult. You can't force them to get treatment if they don't want to. But usually what I say to people is say, listen, if you're comfortable with this, you can say, I'll go to the first appointment, or if you want, I can help you when you make that phone call. And usually if you talk to the person beforehand and you feel comfortable with them, this can be wonderful and effortless. It can be really quick, but also some people, it's better to kind of go through with a workbook or with a video, and they can watch someone else go through the treatment and then go through the same steps that they have. And reaching out in a very non-judgmental way, because that's the fear that we all have, right? Of being judged, not being good enough, making a mistake, is really scary. And often people have lived with this for a very long time in silence. And some people feel a lot of shame because they feel like they're so strong, they should be able to fix anything. But, if my car was broken down, I'd bring it to a mechanic. I wouldn't try to fix it myself because that would end poorly. And so the same thing for anxieties.
This is Georgia Dow. You're listening to On Life Unrehearsed, and she is talking about how to handle and manage fears and phobias. You said exposure therapy, CBT, just because I'm familiar with it, but maybe others aren't. In a nutshell, very quickly, what is exposure therapy?
Yeah, so exposure therapy is you expose yourself towards the anxiety. So you walk towards it. So say that you had a fear of snakes. We might start with a stuffed snake or a drawing of a snake, and you go through breathing techniques to be able to calm yourself down, and then go to another level. And then you go through a calming technique afterwards.
So, Corey, I'm going to bring in a little crate Sunday, okay? We're going to exposure therapy,
Yeah.
Corey.
No, it's not going to work out. She has to go towards the snake, not have them got it.
Right.
Make it worse.
Okay, got it. All right, and we, we're talking kind of in jest here. However, sometimes phobias are Georgia, and for lifelong, when it can be treated. So, what can we do? What would you suggest is besides, talking to experts like yourself, what are some of the things that we could do right now to try to deal with these things that we've been put on the back burner for so long?
First, just to kind of go through it and acknowledge it, and maybe write it down or journal. I always say also exercise. If we're feeling fit, things are so much easier to cope with. Sleeping well. If you're not sleeping, you're going to feel more anxious. Eating well. And then laughter, fun. As we're going through different traumas in our life, it's nice that we make sure that we surround ourselves with good, positive people.
And Georgia, you have an amazing sense of humor and a great laugh. Great laugh. So thank you so much for your words of wisdom. How do people reach you?
So you can head on over to the Montreal Centre for Anxiety and Depression, and you can also send me an email. It's westmounttherapy.com.
All right, that's Georgia Dow. Georgia, thank you so much for your words of wisdom. We really appreciate you coming on the show again.
Thank you so much.
All right, Corey, we have an exciting show next week as well. Tell us about it.
Exciting. It's an interesting word you're using. Okay, next week we will be discussing the increasingly important topic of advanced care planning. How do you have those difficult conversations with family members?
Yeah, that's always tough, and we're always, Corey, we're always talking about it, but sometimes just to even get that discussion started, similar to the phobias that we just talked about, you try to get that initial discussion going about your advanced care planning. Put yourself in a position and be proactive to make those decisions instead of having some government authority make those decisions for you. And although, Corey, a subject that I'm probably not too familiar with, the effects of menopause. However, there are many men that are very interested, as well, of course, females, concerning about the effects of menopause. Both women and their partners will want to hear about what our expert has to say. So thank you for listening today, and many thanks to our technical producer, David Simon, for working the board for us. And you can catch us next week, as you can every week on Sundays at 4 p.m. on CJD 800.